Did you just pee in your pants and you're as embarrassed as hell? I'll bet you don't even want to go out in public again. Well, let me help you understand what's called overactive bladder. I am Jeff McQueary, a Tennessee gynecologist. I'm here if your gynecologic problems are dominating your life and you want to take back control. Solve your problems with solutions from my channel, Women's Healthcare Answers. So the definition of overactive bladder, according to the International Society, is urinary urgency, usually accompanied by frequency and nocturia, with or without incontinence, and it's in the absence of a UTI. Well, that's a lot of big words, so stay till the end so I can give you a real scoop on how I, a urogynecologist, understands your problems and treats your overactive bladder. So what is urinary urgency? Well, that is when you have a sudden, compelling desire to pass your urine, and it's difficult to wait. This is really the bladder muscle squeezing the urine and not really allowing you to be able to control it very easily. And what is urinary frequency? Well, the normal number of times you go to the bathroom during waking hours, and normal is about 6 or 7. So there's many factors that can change the number of times you go to the bathroom, including how many hours you've actually been awake, your fluid intake, and other medical factors. What about that nocturia? What does that mean? Well, nocturia is getting up at night in order to go to the bathroom. One time is considered to be normal, but beyond that, it can really disturb your sleep. There are many factors that can cause this going to the bathroom at night, including sleep apnea, because you wake up. You may also make too much urine at night or drink a lot before you go to bed, and these can all be factors that can lead to you getting up at night. What is urinary urge incontinence? Well, that is when it becomes severe and you get that severe desire to go to the bathroom, and that squeezing bladder muscle leads to leaking urine that you can't control. Often people with these kinds of problems have to start wearing pads or diapers just to catch the urine when they leak. But how do people come to my office when I'm trying to evaluate these problems? Well, what we just talked about is typically when people come to the office, they note a story of strong urgency episodes and going to the bathroom very frequently. They may get up a lot at night, and especially in elderly patients, this can lead to them falling at night because they have to get up and rush to the bathroom. Often they don't make it in time, and incontinence can happen anyway. So what should your doctor do? The first thing they should do is take a very good history from you trying to determine whether or not there are other medical reasons for you having these urinary problems. We also want to know if you're drinking a lot. Often people drink an incredible amount for various reasons. Being thirsty is the obvious reason, but sometimes you feel you should drink excessively because you've been told you need to drink 8 glasses of water a day. You really ultimately need to drink what your body's thirst is telling you, but excessive drinking of water and water-based fluids can certainly lead to excessive desire to go to the bathroom, and that's the main point here. So your doctor should also look at your medications to make sure there's not medications such as diuretics, which are fluid pills, that are excessively causing more urination than you can stand. Don't get me wrong, you need those kinds of medications, but it still can lead to difficulty if you have urgency incontinence. But you should also get a physical examination, which includes an abdominal exam, an examination of your urinary and genital areas. And during that physical examination, your doctor should also determine if you have any problems with dementia. So a physical exam should include kind of a cognitive assessment. We should always look at urinalysis to rule out bladder infections and blood in your urine as well. But certainly if there's a suspected UTI, then urine culture should be done to rule out bacteria growing in your urine. We may also look at things such as a post-void residual, and this really measures how much urine is still remaining in your bladder after you've already emptied it out. One of the very common things that doctors ask you to do is a bladder diary to document how many times you go to the bathroom, how many times you leak, how many times you get up at night, how severe it is, how severe that urgency is, and how much you drink and how much volume of urine you actually pee out. If your doctor is having difficulty in trying to understand what is actually causing your problem, they may also consider more in-depth testing of your bladder. And this is called urodynamics. But it's typically only done when we have difficulty in treating you based upon your history and exam. We just don't know. What are the treatments for overactive bladder? Well, although having these difficult issues with urination and urgency really can affect your life, it's not life-threatening, really. But your quality of life certainly can be very altered, and often you won't participate in normal things you would, like going to ball games or going on a long walk. You're always worried about leaking and where the bathroom is. Most of my patients who have urgency know where every bathroom in every store is, and you probably do too. One of the most important things to understand, though, is that to be treated for overactive bladder, you have to be willing to do whatever your healthcare provider asks you to do. Often they're going to suggest behavioral therapies, and these therapies consist of bladder training, bladder control strategies, and pelvic floor exercises. But it's not uncommon to learn these strategies by going to a pelvic floor physical therapist. This is a therapist who has specialized training to help you understand your pelvic floor muscles, how to strengthen them, as well as how to increase your bladder control. Now, your doctor may even have you decrease the amount of fluid you drink. There is evidence that even a 25% decrease in fluid intake can reduce urgency and frequency, and I've really seen this work as well. All of these therapies are what we call first-line treatments, because they're the first thing you should do. If there's a first line, there's a second line, and this is medication therapy. So what are the medications that could potentially help with overactive bladder? Well, there are two categories of medications that can really help with this overactive bladder issues. And the first category is what's called antimuscarinic, or also known as anticholinergic medications. The generic names of these medications are darafenicin, oxybutynin, sulfenacin, tolterodine, and trospium. You may have been on medications such as these, but because it's most effective in my patients, I typically use the sulfenacin. This was a brand in the US. It used to be called Vesicare. It had a funny commercial years ago with pipes walking around that didn't leak. It was an obvious play on words. Well, these kinds of medications have some common side effects, such as dry mouth, constipation, dry eyes, and blurred vision. Some more serious side effects could be severe urinary retention leading to bladder infections, and even cognitive impairment, which could be dementia-related issues. Now, there's a lot of medications that have all these type of anticholinergic side effects as well, and you really don't want to combine those medications because they can have additive effects that makes those side effects, such as the dry mouth and constipation, and even some of those more serious things, worse. But these medications should have never be used if you have narrow angle glaucoma. So if you've been told you have this type of glaucoma, it's not a medication that should be prescribed to you. So make sure that your doctor knows about that diagnosis. But also, if you have a family history or personal history of dementia, it may be best to stay away from this category. So if you like this video so far, hit the like button. It really helps with YouTube, and please subscribe. If you miss any of my new medical videos coming out every week, who am I going to talk to? Just give me a thumbs up and please comment. So back to the information. The other line of medications is called beta-3 adrenergic medications. There's two brand names of this in the US. They're known as Myrbetriq and Gemtesa. And both of these medications have less of those potential side effects as the other brand, such as dry mouth and constipation. They work very differently and they don't have those problems. But they're really trying to relax the bladder muscle rather than decrease its normal function. They work very well, but if you have out-of-control hypertension or some other type of heart disease, it may not be the best thing to be on. This category of urgency treatment does not worsen dementia either, so it can be used with patients who already have some of those kind of issues. But the biggest problem is they may be quite expensive and difficult to afford. So you may not be able to stay on them even if they work. And if you've tried all the medications and they don't work, what do you do then? Well, that leads us to a third line therapy. So you've done the first and the second. Now you do the third. If all else has failed, we then go on to this next line, which is Botox injections into the bladder muscle, a technique called posterior tibial nerve stimulation, which is stimulating the ankle nerve to try to get the brain and bladder to communicate better, or what's called sacral neuromodulation. And this is a bladder pacemaker device that is placed under the skin that can also stimulate the nerves of the pelvis to function properly again. When we get to this point of using these types of therapies, though, it has become a more complicated problem. But each one of these therapies can be very effective for the right person. Typically, a gynecologist who specializes in urogynecology or a urologist are the doctors who do these specialized therapies. Since I am a urogynecologist, what do you do if you come to my office? Well, first thing, I'll do everything that I've said with taking a good history and physical exam. I'll also get a urinalysis on you and try to see what is causing your problem. I want to evaluate you if you're drinking excessively and if you're on medications that are causing some of these problems. I definitely want to see also if pelvic floor physical therapy and behavioral therapy can help and whether you've done that or not. Often, even on the first visit, though, we will try these medications and have you start recording your voiding diaries that we talked about and see if the medications are effective. I know voiding diaries are always a hassle. It really gives me good information about how your bladder is functioning during the day that because I'm not with you, but it proves your story and it becomes a contract with insurance to help you get the treatment you need. If your problems are more resistant to the normal treatments, I will get advanced testing to see if I can figure out your bladder. And lastly, if nothing helps, we will consider either the Botox or the nerve therapies that I mentioned briefly. And I've done hundreds of those therapies and they can be incredibly effective. But all in all, about 90 to 95% of you who have overactive bladder can get help. I want to give you hope that your quality of life will be better. So hopefully you feel you learned something. And as always, I've enjoyed being here with you. I would love to help solve your problems at Women's Healthcare Answers. Remember, this video is meant for information purposes only. Please consult your own healthcare provider, but it's okay to reference the information I give you.